Welcome back, children. So we will see the second bacterial disease, pneumonia. Okay, first you write the definition for pneumonia. P silent, so we want to pronounce as pneumonia. What is pneumonia? Pneumonia is an infection of one or both lungs. Okay, pneumonia is an infection of one or both lungs, which is usually caused by bacteria, viruses or fungi. Is that clear, children? That is only we can define as pneumonia. So what is pneumonia? Pneumonia is not a disease actually. It is an infection. It can be, so it will affect one or both of your lungs, and it can be caused by bacteria also, viruses also or fungi. So in this chapter we are going to learn about some bacterial pneumonia. And even if a coronavirus is affected, you will get pneumonia stage. Okay, when your lungs are filled with your air sacs, or your lungs are filled with more mucus or like that condition we can call it as pneumonia. So pneumonia can be caused by, pneumonia infection can be caused by bacteria, viruses or fungi. Is that clear, children? And here we are going to see about two bacteria, how it will cause pneumonia to human beings. You write down, it is given your NCERT book also. Streptococcus pneumoniae, it is the first bacterium, okay, which will cause pneumonia infection for human beings. And second is Haemophilus influenza, okay, and this Haemophilus influenza is a fever which can be spread through bacteria. It is different from flu, F-L-U, flu, that will spread from influenza virus. So here you want to remember, this pneumonia can be spread through bacteria also, virus also, fungi also. So what could be the examples for bacteria? Streptococcus pneumoniae and Haemophilus influenza. This also we can call it as flu. This is bacteria, but one more flu is that is flu virus, that is also we can call it as influenza fever. And whatever the bacteria or fungi or virus means, what is the organ is affected is alveoli of lungs, that is the air sacs of your lungs. Alveoli get filled with fluid. Now we know, we have learned, in lower classes we have learned, now it is spreading through the drops of from infected persons. It will enter to the nose, it will enter into the nose and it will reach your throat, okay, and it will be there for some days, a few days, that is upper respiratory region. It will be there and it will come to the trachea, okay, and come to the bronchi, two bronchi, and it will enter to the bronchioles also. So this bronchioles we can see air sacs. Air sacs has so many alveoli, and every alveoli, every air sacs are filled with the fluid because of the bacterial infection. So this is the air sacs. Now tiny air sacs are filled with the, normally it will filled with the oxygen, and if a person is affected by bacteria or virus, it all filled with the fluid, so the person can't able to breathe normally, because if it is free only, we can see the exchange of gases would takes place between the alveoli and the blood through the capillaries. If it is filled with the fluid, there won't be exchange of gases, so automatically the person is affected from suffocation. So this is the Streptococcus pneumonia, and here it is a Haemophilus influenza. And this is in the case of Streptococcus, and Haemophilia influenza, it will affect the other part also. Now we know normal respiratory tract and also lungs. Apart from that, it used to affect the brain part also, okay, meninges. So that is because of the Haemophilus influenza. And here how it is spreading from a person to other person through inhaling of the droplets or aerosols released by an infected person. And what are the symptoms? Fever, the body temperature will be chill for some time, and cough, continuous cough will be there, headache will be there. In severe cases, the lips and fingernails turn grey to bluish color also. Now look at, this is the normal, okay, this is the normal condition where between the alveoli we can see some air spaces, okay, but come to the inflamed air spaces filled with the fluid. Now all those things are filled with the fluid. Now the lungs become very burdened, because it is, instead of filling with the gases, now it is filled with the fluid. So it is very burdened to breathe, and it is leads to asthma, and they can't able to breathe normally also. So how can we detect whether the person is affected by pneumonia? Normally they'll go for X-ray studies. So this X-ray studies will help to notice the fluidity of the lungs. So with that X-ray also we can test the range of affection, range of pneumonia affection for person also. So X-ray also can be done. So physically also a doctor will check with the stethoscope. They'll keep it in a chest, and they'll hear the sounds. If instead of normal sound, if the sounds like some breathing problems is there, means automatically the baby's wavelength, the sounds will be noticed through the stethoscope also. That can be done. If it is not stethoscope, we'll go for X-ray. So physical method of observation is a stethoscope. If it is not stethoscope, normally we'll go for the X-ray studies also. That can be done to identify the pneumonia condition. To identify the pneumonia condition. If not, if it is a high, if not the person they can't able to guess, means they'll tell to do for testing. Okay, they'll tell to do for testing. They'll take some fluid or pus which is present in their lung air spaces. They used to take a fluid or pus which is present in the air sacs. They'll do the sputum test, sputum, sputum test. It is very good for bacterial culture. Suppose if a person is affected by the Streptococcus pneumonia, means we can able to diagnose with the help of sputum culture. So what is sputum? A mucus which is present in the air sacs of alveoli. So with that they will take a mucus and will check whether the bacterium is present or not. So that test we can call it a sputum. So what are the tests is available? Physically will do with the help, physical examination can be done with the help of stethoscope, or will take a chest X-ray. Second, third will do for sputum culture. If it is not, the doctor is not getting any idea about, means automatically the doctor will prescribe go for one bronchoscopy bronchoscopy method. So that spelling I'll tell: BRONCHOSCOPY. Bronchoscopy means here they'll insert a flexible tube into the nose, and also it to nose, and through this tube they'll collect some pusses or fluid, and it can be done with the help of the doctor, well advanced, well trained doctor, or well trained nurses. For that they should give anesthesia. So with that also, with the procedure called bronchoscopy, with that also will take a mucus and will examine with the infected part. So that can be done. So these are the some diagnosis of pneumonia. Okay, and with that any one of the method a doctor will find out the problem. Okay, so once if the doctor is confirmed it is pneumonia, means obviously what he will give some, if it is a bacterial pneumonia, he used to prescribe penicillin and ampicillin and erythromycin, like that antibiotic he used to prescribe to get rid of from the pneumonia fever through a bacterium called Streptococcus pneumonia, or the other pneumonia also. And if it is a virus spreading, means antibiotics won't work. Even through coronavirus also a person will affected the pneumonia stage, but antibiotics won't work for the viral diseases. And is there any vaccine is available for pneumonia? Yes, there are some vaccines are available. every, for example, if it is a viral pneumonia or the viral pneumonia means every year we want to take a vaccine, because every year the strains will keep on changes. And for bacterial pneumonia we'll take a vaccination. Bacterial pneumonia will take a vaccination. So vaccine is available. For viral vaccine every year we should take. Suppose when we get disease means we want to go for doctor to get antibiotics. So antibiotics is good for only bacterial pneumonia, not for viral pneumonia. Is that clear, children? What are the common symptoms? We have already no. There's a fast breathing and sometimes slow, very slow breathing, cough, and we'll get a heartbeat, high rate of heartbeat, and sometimes they'll used to experience like vomiting and diarrhea. These kind of symptoms we can call it as the symptoms of the pneumonia. And sometimes so for some people it will show only mild symptoms. So in that condition we can call it as a walking pneumonia. Only for few days it will be, and the person will be all right because of the immunity power. So that kind of disease we can call it as walking pneumonia. And how to prevent this pneumonia means we want to maintain a good health and hygiene, and we need to wash our hand frequently, and we need to take a vaccination. And for elder people we want to take extra care, and they should not affected by other diseases. If other diseases, if the person is affected, automatically their immunity power will be reduced. So automatically there is a chance of getting pneumonia also. It leads to even death also. And should follow proper diet and regular exercise, plenty of sleep, and do not smoke, and you should avoid all those tobacco addiction. So if you are practicing all those things, automatically you will be get rid of the flu, that is a pneumonia fever. Is that clear, children? So next video I shall send the common cold. Thank you.